I don't remember a thing. Honestly, I don't remember.
I don't remember how I got here.
No, okay, all right. I remember your mother was in the waiting room. I remember that.
She was?
Yeah. Okay. And you don't remember any of the procedure?
No, I don't remember anything with the procedure.
Hi there. My name is Dr. Nick Calcaterra, and I practice sedation dentistry in Orange, Connecticut. We just heard from two patients of ours, Leslie and Jennifer, who described their sedation experiences in our office. And they summarized them quite simply, and that is they don't remember anything. But how do we describe sedation dentistry? As an office that has done hundreds of sedations over the past several years, we like to describe it this way. Sedation dentistry is a technique in which we have a very fearful, anxious, and phobic patient to whom we administer a series of medications, either through an IV or orally or as a gas, that will then make that very fearful, anxious, and phobic patient become totally relaxed, free of anxiety, and nearly asleep, thus enabling them to receive the dental care they desperately need and deserve. So, what causes dental fear? How bad is it? Let's listen to two more patients of ours, Leslie, who you've already seen, and then another patient named Jennifer.
I don't like the dentist experience. Growing up, being young, had some really bad experiences. But when I came here to see Dr. Nick, I turned out it wasn't as bad as I thought. You know, being afraid of dentists is normal. And here I am today. I'm back again. Back again.
So I'm here with Jennifer. We were talking a little bit about some of her fears, right? Mm-hmm. Okay. So, are you afraid of spiders?
No.
Are you afraid of snakes? Are you afraid of heights?
No.
Afraid of flying on a plane?
Nope.
Afraid of speaking in public?
Not at all.
No. So what's your biggest fear?
Going to the dentist.
Right. So, would you rather be on a plane speaking to all the passengers with a snake around your neck and two spiders on your finger than being at the dentist? Which is worse?
Going to the dentist.
Okay, all right. As we saw with Leslie and Jennifer, fear of the dentist is real, but it is nothing to be ashamed of. If you're afraid of heights or snakes, should you apologize for it? Of course not. So why should fear of the dentist be any different? I've had the personal privilege of treating hundreds, if not thousands, of dental phobic patients. Some, like Leslie, had a bad childhood experience. Others are okay with simple things, but are petrified of procedures like root canals or extractions. Others might be self-conscious or embarrassed about their smile and just don't want to be judged. Whatever the reason, sedation dentistry is the solution. Let's hear from two wonderful patients of ours, Joseph and then Helen.
I'd like to thank Dr. Nick Calcaterra and the whole staff here. If it weren't for the sedation, I probably would have delayed having my wisdom teeth removed.
I'm glad that I have you to come to and have a dentist that I trust and feel very comfortable with to come, because otherwise I would be in trouble. I wouldn't be as eager to go to a dentist and get the work done and suffer and be in pain potentially.
Yeah, and then things probably would have gotten worse.
Yes,
yeah.
Unfortunately, yeah.
All right.
That's
so you wouldn't have such a beautiful smile that you have now.
Thank you. Right. Thanks to you.
You're welcome. Joseph, who we just saw, was too scared to have his wisdom teeth removed, and Helen was fearful all around and simply did not trust dentists. In both cases, sedation helped them overcome their fears and get the treatment they needed. It's that simple. We'll shift gears and see how we make sedation safe for all of our patients. Let's hear from Jennifer again.
After they explained to me the procedures and they put the monitors on me to monitor my heart rate, from beginning to end, they were completely in touch with what I was going through. They were monitoring me the entire time, so I never once felt that they were not in control of the situation. No matter what happened, they were on top of it. And so I never once had any concern about, pulling a Michael Jackson and not waking up at the end of the procedure.
As we just saw, Jennifer was impressed with all the monitoring we did for her sedation. To gain licensure to administer IV sedation in the state of Connecticut, you must undergo extensive additional training, invest in sophisticated safety equipment, and pass a rigorous exam. Because of these requirements, there are only a select few general dentists in the entire state who hold a license to perform sedation. You should always seek out a provider who holds this permit. If you are sedated in our office, you can rest assured that our entire team has all the licenses and training needed to perform sedations safely. Well, we hope you found this video to be educational and at some points entertaining. We'll listen to some final thoughts now from Leslie and Jennifer, and we do thank you very much for your time.
I would recommend sedation with Dr. Nick if you have any doubt coming into the dentist. It's not a bad thing. It's something to help you get through your fear, anxiety, your procedure.
I would recommend sedation dentistry. If you have fear of dentists like I do, you do not remember anything. You are completely knocked out. So if that's a concern, you don't have to worry about it. You are completely zonked out.
Thank you so much.
You're welcome.